everybody. Welcome. So
Morning.
excited to see your faces. I love when people come on camera. Nice.
Welcome, State Representative Kifowit. Thank you for being here with us.
Yeah, we're not gonna know what it's like when we're not in a little box anymore, right? Someday soon. Someday soon.
Someday not soon enough.
I know. Hope is out there. Hope is out there.
If everybody could put yourselves on mute, that would be helpful. We'll get started in just a minute. Sounds like there's still a bunch of people joining us. And don't forget to put your name in the chat with your organization. Helps us to know who's all here today. All right. Okay, I think in the interest of time, I'm going to show you the agenda for today. Good morning, everyone. Thank you so much for joining us today for the DuPage and Kane County Advocacy Collaborative. Our theme this year is Advocating Together While Apart. My name is Gretchen Knowlton. I'm the Manager of Planning, Advocacy, and Program Development at AgeGuide. And with me today is Leslie Edstrom, the Director of Planning, Grants, and Program Development. And I'm going to introduce our other speakers as we go through the agenda. You can see it up on the screen. And as you can see, we have an excellent...
I can't hear anybody talking.
Is everybody hearing me okay? Okay, you might have to check your audio. Just to make sure that we don't miss any of the agenda today, please put yourselves on mute. And if you have a cell phone next to you, which almost all of us do these days, please put that on mute during the presentation as well. Also, I wanted you to know that we are recording this event. And now in this virtual world that we find ourselves in, if by chance you lose connection, please just go back and re-click on the link to rejoin the event. And you can always call in as well. We'll put that number in the chat so you have it. I want to welcome those of you who are joining us by phone today. You won't be able to participate in the chat, but we're glad that you're here. And now I would like to just find out who all we have here. We have a number of AgeGuide staff with us today who are on the call. So I'm going to ask you all, everyone who's on the phone, to locate the reaction buttons down at the bottom of your screen. If you're on a video connected device, if you're on your the phone, you won't have that. But if you're on with us on video, if you could look for those reaction buttons down at the bottom. And first, I'd like to introduce all the AgeGuide staff who are on the call. So AgeGuide staff, would you please use the raise hand button to show everyone that you're here? So everyone knows who you are. You can keep your hand up. If you are a service provider in the community, please click the clapping hands icon to let us know that you're here. Great, wonderful, lots of community providers. Now, if you're an older adult yourself, 65 to 165, go to the bottom of your screen and click the heart for me, please. So we know that you're here. We welcome all of you. So glad you're here. If you're an elected official, a legislator, or a staff from an elected official's office, please give us the thumbs up in the reactions so we know that you're here. Welcome. Thank you all for being here and taking the time out of your busy schedules to join us. I would especially like to acknowledge the legislative staff who are here today and the legislators on the call. We have State Representative Stephanie Kifowit with us. She needs to leave a little early, but we want her to have a chance to say a few words. So we'll be moving the agenda around a little bit, but we will get to her. We also have Maria Manzo from Congressman Bill Foster's office. Leslie Reese from Congressman Krishnamurthy's office, and we'll be hearing from many of these special guests during the remarks portion of the agenda. We also have a few other legislative staff joining us today. We want to welcome Mimi Cohen from State Senator Laura Ellman's office, Haley Edwards for State Representative Barbara Hernandez, and Miguel Molino for Representative Maura Hirschauer. And I believe we have Michelle Timois from Congresswoman Lauren Underwood's office. So there will be time for questions and answers to these folks and to all the presenters. So feel free to put any questions or comments in the chat, and we'll try to get to them as we are able to. And now it is my pleasure to introduce to you Marla Fonsack, Chief Executive Officer of Age Guide Northeastern Illinois. And I will share my slides for you, Marla, in just a second. Sorry.
My apologies. Can you hear me? Okay. Perfect. Thank you. Sorry about that. That's our catchphrase for everything now. Am I muted? Am I on?
Okay.
Thank you. Welcome, everybody. Thank you so much for joining us for our Kane and DuPage Advocacy Collaborative. As Gretchen said, I'm Marla Fonsack, CEO of Age Guide Northeastern Illinois. We're the area agency on aging for the counties of DuPage, Grundy, Kane, Kankakee, Kendall, Lake, McHenry, and Will counties. As of the last U.S. Census, there were over 703,000 older adults that are residing in, I'm getting a pop-up. I'm sorry, I was getting a pop-up on a video.
Marla, your video's not on right now.
Oh, that's what happened. Okay. Hang on. I was getting that pop-up. I didn't know what it was. My apologies. Oh, what's that? Advocating apart while together. That's what we're trying to do. And now I'm muted. Okay. All right. Are we good now, Katie? Are we good, Katie?
Yes, ma'am.
We can hear you.
Thank you. Sorry about that. So let me be clear that while I say there's 703,000 older adults residing in our 8-county region, we are all aging. And that's a really good thing. So by 2030 here in Illinois, 25% of us will be over the age of 60. Older adults are also an increasingly diverse population of racial, ethnic minorities, and often they're dealing with physical and mental health challenges. And that could include the onset of dementia. I'd like to take a moment to take you back to a year ago today. We were addressing many of the same challenges we are today, but very differently. Our community dining sites were packed with older adults enjoying each other's company. We had vans full of older adults that were crisscrossing our counties, taking people to doctor's appointments, shopping. Our senior centers were all abuzz with spring parties, bingo, exercise classes, and so much more. And then in mid-March last year, all in programming that our older adults relied on came to an immediate halt. Our community dining sites, senior centers, all shut down, and they have still yet to reopen. Many things have changed since then. We've changed, and we will all never be the same again. Next slide. Social distancing worsened the social isolation that we were working so hard to address. It heightened already existing vulnerabilities like access to food, medication, medical care. So we had to help our older adults stay safe and connected at home. Our network started to reinvent programs and services to provide creative ways for people to connect. Virtual cooking and exercise classes sprang up. We played parking lot bingo, and thousands of friendly phone calls were made to engage our older adults. To address our technology challenges for them, we started teaching them how to use Zoom, Facebook, email. We offered internet-enabled devices through a partnership with T-Mobile to help those who did not have access to Wi-Fi. This was vital not only to connect with family and friends, but their physicians were also starting to use telehealth for office visits. And interestingly, according to a recent study that quantified some of the digital isolation crisis that we were experiencing with our older adults, of the 80% of them who died of COVID in the United States, it was estimated that 40% of them were unable to access needed online resources because they lacked in-home internet. And our Black and Latino seniors were even more than 2.5 to 3.5 times more likely to be offline. Next slide. So even prior to the pandemic, older adults were experiencing food insecurity. So to make sure that they received the nutrition they needed during the pandemic, Age Guide took this as our top priority. Our home delivery meal programs expanded to include anyone who was age 60 and older. And as you can see from the slide, our network of nutrition providers ramped up meals since last March, and we've seen an almost 60% increase in the need for them. From March to September, the network provided a total of 877,000 meals to almost 11,000 people. We also had to modify how we distributed meals to accommodate our new reality. So these meals were mostly still delivered directly to homes, but thousands were picked up at designated locations, and shelf-stable meals were also provided for emergency use. Now, I want you to keep in mind, our network continued to increase services while navigating COVID-19 protocols with their staff and volunteers, many of whom themselves were in the high-risk age group. Federal and state support for these programs during COVID was a lifeline for the aging network in responding to the pandemic, and a continued support will be needed to maintain our current increased capacity to provide these meals to our region. Next slide. Caregiver needs increased during COVID as more people were providing help for their family members to keep them safe at home. We expanded and adapted our caregiver support programs like counseling and support groups, so we could help them cope with the stress and isolation of caregiving. And to further reduce their burnout, we offered caregivers a tailored assessment called T-Care, which really helped pinpoint their stressors and help them to further prevent any stress or burnout. Isolation was magnified for these family caregivers, especially for those for loved ones with dementia. So to combat this, we decided to start offering virtual programs like our intergenerational music and memory program, our Sounds Good choirs, and memory cafes. All were there to keep their loved ones engaged and less isolated. And though incredibly impactful for these caregivers and their loved ones, there is still not enough resources to meet this growing demand. So we know that our programs and services will not return to what they looked like last March, but really that's okay. This experience allowed us to reinvent and expand our programs that further improve the quality of life for older adults and caregivers. The pandemic ignited a spark of change that was long overdue, and it showed us we could do it, but we are not done yet. Next slide. Our challenge now is to get our older adults vaccinated to further reduce social isolation, food insecurity, and caregiver burnout, so that our older adults can safely return to life outside their homes. These older adults sacrificed a year of their lives to stay safe and keep their families safe from the virus. And unfortunately, far too many of them died from it. So getting them vaccinated is our top priority, and we are working hard, coordinating efforts with our funded partners and local health departments to get all older adults registered, provide them with transportation when needed, and even to try to deliver vaccines to them in their homes if they are unable to get out. Next slide. So in order to do this, we're asking for some help. We want to really take what we learned, but we want to keep it going, and additional support is going to be needed because not only are we serving more people, but we need to get them all vaccinated. What we need to do this is to strengthen caregiver support at the federal level through increased funding for family caregiver programs. And we want continued funding, for essential services during COVID to address food insecurity and social isolation. Those two big crises we've been talking about. And we need our elected officials to prioritize the support the aging community in the vaccine rollout and outreach. Next slide. At the state level, we are asking to get additional support for long-term care facilities. During COVID-19, almost 50% of the deaths occurred in long-term care facilities. These residents and staff need to be protected from the virus with more PPE, improved infectious disease control, and more frequent testing and reporting. And with limited visitation, resources are going to be needed to provide additional technology so that families can continue to visit safely. We ask that funding be appropriated for the Illinois Family Caregiver Act. Representative Willis introduced House Bill 293 and Senator Belt introduced Senate Bill 1766 to fund the Illinois Caregiver Act. And this was an act that was passed in 2004, but has never been funded. And lastly, I'd like to close with having an ask to all of our elected officials to continue to prioritize and support the aging community and the vaccine rollout and outreach. Thank you.
Thank you, Marla. Appreciate that. I wanted to take a moment. I missed introducing one of our legislators who's joined us today. I want to thank Senator Tom Fullerton for joining us today, and hopefully you will have a chance to stay with us and say a few words in a little bit as well. So thank you for joining us, Senator. And now I want to introduce to you our next speaker, Michael Isaacson, who is the Assistant Director for Community Health at Kane County Health Department. AgeGuide was introduced to Michael through his advocacy and work on vaccine rollout in Kane County. He has been a great partner to AgeGuide and the Aging Network. As we've collaborated with him on getting vaccines to older adults, he has been committed to making sure that older adults aren't left behind in this process. Michael, we know that you are extremely busy right now. I know you're going to leave us and go right to another meeting after this. You're putting out a million fires. We are so honored and grateful that you're here with us this morning. And with that, I will turn it over to Michael Isaacson.
Great. Thank you so much, Gretchen. I'm really happy to be here with everyone today. I just want to echo all of the great comments that Marla made. This has been an extremely tough year. And even though it's miraculous that we're in an age where we can have now 3 vaccines to protect our residents from this virus, we still understand that it's been a long, frustrating process for people. It is getting better. So I'm just going to share a little bit of information about where we are right now in the community. You can see that this slide shows the number of tests that are coming back positive. So our test positivity rate right now, out of every 100 tests that we're doing, about 4% are coming back positive in the Kane DuPage area. So this is much better than it was a couple months ago. We've had a couple of days where we've seen a slight increase. So we still want to remain vigilant, but overall, this is looking very positive. So people are practicing social distancing, they are wearing face coverings, and now every day more and more people are being protected by vaccine. We're also seeing a good decrease in the number of people who are hospitalized. So the number of tests coming back positive is a good indicator of what's happening, but ultimately we want to see less hospitalization and less death. So in this chart, it's showing over the past month in Kane and DuPage County, we've seen steady decreases in the number of people hospitalized, with only 2 days out of the last 30 that were either stable or a slight increase. The most important measure is how many people we're losing. And as Marla mentioned, we lost far too many of our seniors over the past year. many in our long-term care facilities where people are living in closer quarters. So we have both a susceptible population and a susceptible location. Good news here is over the last couple of months, the number of deaths have started to drop off from their peak. So that's positive. We're still losing an average of at least one person in Kane County per day. This chart is specifically for Kane County. So we're seeing improvements, but we're still not where we want to be, which is 0 people dying from COVID. In terms of vaccine rollout, when the new data comes out from the state today, we are going to be really excited because we are going to be over 100,000 vaccines administered in Kane County. So that's a fantastic milestone for us. I do like to point out too that out of that 100,000 doses, 40,000 of them have been administered in the last 2 weeks. So even though we've been at this for several months now, the rate that we're able to get out and protect people is finally picking up, where the amount of vaccine coming into our community that's available is at a rate where we're able to protect more and more people every day. So the average number of people being vaccinated each day is steadily increasing. This slide shows a little bit about both the age breakdown and the racial breakdown. As was mentioned, we have been working very closely, and this is a worldwide effort, but our vaccine rollout is a national effort. We work very closely with the state government, so I thank the elected officials who are on the call that we work closely with to host clinics. But I really want to thank Mickey Miller from Senior Services and Marla and Leslie Edstrom from Age Guide, because at the local level where the plans really, where the rubber meets the road, I think we've taken great strides in protecting our seniors here in Kane County. So now we have almost half of our seniors have at least had their first dose. We've hosted seniors only clinics. So last week, we vaccinated about 3,000 people at Elgin Community College, all seniors. Also, we understand that with the technological issues that some people need help registering because we're so reliant on computers now. So through partner organizations like Age Guide, like Senior Service Association, and many others, the Kane County Health Department's been putting aside specific slots for each of our clinics where only people who are calling those organizations because they need assistance with technology, they're getting a first opportunity. So for our clinics last week in Elgin, 700 people who did not have computers were able to register through our partner organization so that they could get access to appointments. So we have a long way to go, but we're making great strides. Just a quick comment on the racial and ethnic breakdown of how the vaccine's being distributed. We're very aware at the health department of social inequities that exist in our communities. A lot of these are underlying structural systems that impact everything in our lives. So we're also going out and making targeted clinics available for different groups so that we can make sure to get vaccine to everyone. So how do you get vaccine in Kane County? We encourage people, if they do have access to a computer, to register with us so that they can get our communications, and we'll let people know when there's clinics available. We also have a list of pharmacies because we encourage people to sign up through different pharmacies. They can wait to get vaccine from the health department, but you also, and more from the state and federal level, vaccine is coming directly to our pharmacies. You may be able to get an appointment more quickly by going to a pharmacy. So we don't want you to wait, even though it can be frustrating. If you really want to get the vaccine as quickly as possible, looking in multiple places is the best way to do that. We are working with other partners like OSCO and CVS and Walgreens to set up clinics specifically for seniors and at senior facilities. So that work is underway so we can actually get in and reach the community. Of course, there is the federal partnership with long-term care facilities where we've had over 9,000 people vaccinated through that program. And we're working with larger employers as well. The vaccine supply is improving, as I mentioned. The number of providers that are able to give the vaccine in the community is increasing every week, making it easier for people to get. And now, as I mentioned, the pharmacies are getting direct shipments from both the state and the federal government so that they're able to offer more. If you don't have a computer, no problem. You can call one of our partner organizations. If you call 211, 211 has the list that we put together through our partnership with Senior Services and Age Guide with the other community partners who've asked to join us in that, so we can help seniors to sign up over the telephone. And then this is a great flyer that Age Guide put together just on how seniors in Kane County can access vaccine, which reiterates some of the things that I already mentioned. So again, this is an area that's really important for us, that we protect our most susceptible population. We want to hear from people when we're not doing enough. Of course, this is all dependent on how much vaccine is available, so we continue to increase what's there. And then finally, just want to encourage people to continue wearing their masks and continue social distancing. There is light at the end of the tunnel. I'm more optimistic over the last couple of weeks than I've been in a while. I think we're moving in the right direction, and we just really appreciate all of us being in this together and moving forward. So with that, I thank you.
Excellent. Thank you so much, Michael. Were there any questions in the chat for Michael before he has to jump off? I think I'm seeing one comment from an older adult who said that she has had difficulty finding the vaccine. And I think you gave us, some hope that that will be changing soon.
It is getting easier, yes. You'll get it, Margie. Don't worry. It'll be available. Nice to see familiar faces on here too. So great to see everybody today.
Thank you so much, Michael. We really appreciate your time.
And if I do need to go because we're actually setting up another mass clinic, but if there's any questions in the chat, I can follow up and get them, and I'm happy to respond to people. So I'm sorry that I have to leave, but thank you for all the great work everybody continues to do.
Thank you, Michael. We can connect folks to you if they need questions answered. Thanks. Right. And with that, I want to give Stephanie Kifowit a chance to speak to us because she needs to hop off for another meeting as well. So it is my honor to introduce State Representative Stephanie Kifowit, who proudly served her country in the United States Marine Corps, served residents in the city of Aurora as alderman for over 9 years, and now as a full-time state representative of the 84th House District. She serves the residents of Aurora, Montgomery, Naperville, and Oswego. Thank you so much, Representative, for being here today.
No, thanks, Gretchen, and everybody on the call, all the community partners that are working so hard during this difficult time. As was explained at the beginning presentation, we are on such unprecedented times, and we are doing the best that we can. And there's a lot more that we need to do, but as was mentioned and just announced just the other day with Johnson & Johnson now having a single dose vaccine, we are looking at having vaccinations for almost everybody by the end of May. Now, just keep that in mind how technology is, because when the COVID pandemic started, the World Health Organization stated that they didn't believe we'd have a vaccine until the end of summer 2021. So now, not only do we have 2 vaccines in limited distribution, we're still ramping that up under the new president, but we now have a 3rd vaccine from Johnson & Johnson that's a single dose that's just going to be a game changer as well. So I think that things are going in the right direction, but I think all our community partners are doing such a great job trying to help all the seniors get their, as was mentioned by Michael, those that don't have computers have assistants that they can sign up for the vaccine through phoning and just being there. I know that, as was mentioned, I am a veteran, and I know our veteran organizations do Zoom calls and wellness calls, and during these isolation times, it was very difficult because a lot of seniors, as was mentioned, participated in organized activities, but they also participated in sporadic activities such as going to McDonald's for coffee. You can always walk in and see a group of individuals having coffee at McDonald's. And so those kind of informal interactions are starting to come as our rates go very low. One of the things that was mentioned is our long-term care facilities and PPE. And now, as under the prior presidential administration, it was almost like a Game of Thrones where we're trying to struggle to get PPE from all the different states. And now under the new administration, we've been able to secure PPE and be able to support not only our long-term care facilities, but also all our healthcare workers as well. So definitely things are going in the right direction. I am so optimistic, and I think that our governor has done a yeoman's job at handling a very, very difficult, unprecedented situation. But it is the work that you all do that's so important to our seniors and to our individuals in our community, to be there for them, as was mentioned, to make sure that they're still getting meals that they can get and still getting that connectivity that is so very important for them all. So I just want to say thank you all for all you do. Thank you for your dedication and for looking out for those that we really need to take care of every single day, and for all the work that you've done during this very difficult time. The lights at the end of the tunnel. We are very, very excited. I'm excited, and our numbers are going down. And so we really should be optimistic that hopefully we've turned a corner and we've learned a lot, and we will continue to help our seniors and be there for them as well. So thank you all very much. And I apologize, I do have another meeting to run to. But definitely I'm running to this meeting. I'm not resuming, so it's actually an in-person meeting. So very happy with that. So thank you. Thank you all for having me and for all that you do.
Thank you so much for being here, Representative. We appreciate your time. Thank you. Next, I'd like to introduce Courtney Heterman. She's the Associate State Director for Advocacy and Outreach at AARP Illinois, where she leads vaccine outreach.
Thanks so much. Thank you so much, Gretchen, and good morning to everyone. So happy to be with you all, and really just want to say just how honored and privileged I am to work with Age Guide. You know, we've partnered several times, and I know in the last couple of years we've been in person, and I can't wait till that happens again. So I'm so always honored to partner with Age Guide, and so many of you too that are on the phone. So just or on our computer. So just so happy to see all of you. So just want to give a little bit of a 6,000 view of all the COVID vaccine work. And really honestly, between Marla and Michael, I don't want to certainly reiterate all of what they said, because I agree with it 1,000%. But I know that we have so many representatives, whether they're at the federal level or state level, that could be sharing this as well. And I'm sure they might be, but just kind of thinking from that federal as well as state and local level, some things that just to kind of keep in mind. Well, as you probably know, AARP is a nationwide organization. And so we have a lot of issues we work on, and many that actually Marla was referencing. We're supportive of all those older, American dollars and all those programs, and those continue to be a priority for us. And that will always be the case. I can't imagine that changing. I will add, though, as COVID happened, and now we're in the vaccine and distribution rollout, this effort has become our #1 priority as an organization. We want folks to have a good understanding of the vaccine, and then that they have the most information possible so they can make the best choice for themselves, as well as their families. So that's definitely where we're kind of coming from, is to be a resource and to provide accurate information. So again, people feel informed and ready to go. So if we look at the federal level, though, one thing I just wanted to share is that, we obviously have a COVID relief package that is now passed the House and it's in the Senate. And, huge dollars, $1.9 trillion. So this is a massive, massive piece of legislation. And now the Senate has actually just voted yesterday to really start debating the bill. So that was a huge hurdle in itself with the Senate yesterday. And now they're really spending a lot today on really voting on some of those particular amendments to that legislation. And so why it's important to kind of talk about this is that you have the president and his administration saying, look, we have, we're going to get more vaccines. That's coming. We hope to get people vaccinated even by May. So the supply is a big part, but also part of this package includes massive reforms or massive pieces that are really important to everyone. So one, you have the issue as it relates to unemployment. So that's about to end. And so that would continue to have folks in the unemployment scenario receiving $400 and those checks. There's also the relief, again, $1,400 stimulus checks. You have, and again, really important for all of us, is in our work is money that is going to go not just to the state, but actual county and municipality levels. Because a lot of what other packages have included in the past, it's just gone to the state. And then sometimes it doesn't necessarily trickle down as much as we needed to our local levels, right? And that's what this would do. So that would give us just a tremendous amount of, again, of relief truly at this very local level. Okay, so then let's switch to now like our state side, right? So let's like think about it. And this has already been talked about in some ways, but these are the things that we know are working. Like if we had talked 2 weeks ago, I'd have a very different thing I'd say. So that's the other thing. This is very fluid. And I think that's something to keep in mind. Every single day, it seems to change a little bit. But what we know, what is kind of not working, and that is we still have issues with supply, although we've been promised, right? So let's just be realistic here. We also don't have a fully centralized system. And you can see, like, you know, obviously Michael talked about Kane County. Well, you can go to any other county in the state and they're doing something tremendously different. So our state is kind of taken the approach of our county and local governments are essentially doing very different things sometimes. There's definitely themes, but we have to recognize that there are differences and it's not quite centralized. I will give major kudos to the governor's office, though, and Illinois Department on Aging, because they are trying to do some centralized work. So do want to recognize that that's coming, and it's perhaps a little slower than we want to, but it's happening. And it's just, this is a Herculean effort, right? It really is. So we got to keep that in mind. So I definitely want to recognize too that we have been very slow to there was so much web-based, and you've heard so many people having the experience that everything's on the web and they have no access to the internet. They don't feel comfortable using a computer. And for our population we're talking about here, 65 plus, it's almost really unrealistic to think that it's just a web-based scenario and that's enough. And even the phones, I think we have another issue going on here. One, there is just not the manpower to handle all those calls coming in and that intake. But we also have to work very hard on an advocacy level, making sure there's dedicated allotments for those folks who are calling on the phone. Because when we have folks that are utilizing that, and then they call and they finally actually talk to a live person, but don't have an appointment because it was all eaten up by those web-based, then what's the point of the phone number? One thing I have loved through the United Center effort is they had about almost 20,000 appointments that were directly allotted for the phone. That's a great step forward. And I think we have to continue to keep sharing those messages and over. Like we need to make sure those phones have appointment slots open for people to then take. Certainly want to highlight the long-term care. We can't be satisfied with 50 and 60% in locations that of those patients and staff that are vaccinated, and the patient side is much higher, which is great. And we got to do a lot more education on the staff side so we can get those particular facilities as much as possibly vaccinated. They're hotspots. We all know that. So we need to make sure that our most vulnerable, really, in a lot of ways, is protected as much as possible. We have to work on Black and Brown communities, areas that we know that there's so many people. It's like the have and the have-nots. The haves, they're out there, they're getting their vaccine. They're going to get it, right? Because they're making sure they get it. It's the people who need more time. They're not sure. They need more information. We got to make sure those have-nots, that they just don't have connection in some way, shape, or form, that they get what they need. And then hopefully then they choose to get the vaccine. We have transportation issues in particular areas as well. We certainly have to do much, much better with the homebound. Those programs are all coming out now, which is amazing. And I think so many counties are really, really doing well. Peoria County, Champaign. I don't want to say that, DuPage and Kane aren't doing their thing, because they are. It's just, we are much, much more dense population in these areas. So we got to work, it's going to take a little bit longer. That's okay. But we're doing really great already, I can tell. And then honestly, we just have to keep pushing the transparency. We will not know how good we've done and how successful we've been if we don't have great numbers and data to back it up. And we have to encourage all of our elected officials. So I'm saying that to the folks that are on this, that are those, like, we need to make sure we have really great data so we know that we've all done really great and this has been successful. So definitely transparency will continue to be a theme. But let me just say what is working really fast. The United Center is a great model right now because it is a centralized system. And so I think we could make an argument that the centralized stuff could work. So I think we should certainly recognize that, although there have been a little hiccups, but I think overall we could say it's much, much more in a positive scenario. I think the partnerships that are happening across the state and in communities is just extraordinary. So many people have pulled up the bootstraps and they're working together. And I can't imagine a better example and a better time for us all to be working together. So the partnerships across the state and again in these local communities are just fabulous. And then very traditional tactics are working. And I want to recognize Aarp is spending a lot of time, doing teletown halls and direct mail pieces and certainly, one-on-one type of phone calls to reach those difficult populations. So very traditional tactics in a very education and outreach way is working. And so we have to keep remembering that. And then just lastly, some emerging issues that we all have to keep in mind here. One, and Marla already made reference, and so did Representative Kifowit, the Johnson & Johnson is a game changer. It really is. So for so many ways. But I will say there's a lot of education that has to take place on now that we have 3 vaccines. People are asking, do I have a choice? I might not have trust in a particular company. Why is the variant, this one includes variants, this one doesn't, this one has more effective rate than this one. Those are legit questions. And I think we have to do a lot of work on some information and education to folks. Certainly want to just there's going to be some people who choose not to get vaccinated. And this is not mandatory. And we have to keep in mind too, those anti-vaxxers. We need to make sure that then they do things for themselves to stay protected and reminding them of wearing a mask and washing their hands and social distancing. And that even with all this vaccine work, which is amazing, we have to keep in mind that we can't necessarily lose all the ground that we've come to, right? We have to continue to do these things for a while until we can maybe not wear a mask. We don't know exactly when that is. So being vaccinated is wonderful, but we can't stop doing the other things too. So it's not a get out of jail free card. We got to all keep doing what we're doing in addition. So I think we need to make sure we share all that stuff as well. So, but again, happy to take questions, even through the chat, and just so happy again to be included in this, and thanks so much.
Thank you very much, Courtney. It's been a great partnership that AgeGuide has had with AARP, and we appreciate that so much. If there are any questions, feel free to put them in the chat. We can always circle back to them when we get to the end. I want to move on now to our next speaker, who is Mickey Miller, who's the Executive Director of Senior Services Associates in Kane, Kendall, and McHenry counties. Mickey is one of these people who loves her job, and it shows. She says that serving seniors with dignity and respect is more than just a job for her. It's what she is dedicated to, because these are the folks who created our communities, and now it's our turn to make sure they're cared for. And now with those words of wisdom, I give you Mickey Miller.
Thank you, Gretchen. I really appreciate having the chance to speak today. And I'm sad that Stephanie got off, because we do a lot of work with Stephanie and the veterans. So I'm sad to not have her on. I want to take you back a little bit to March 13th of 2020, when the governor talked about the shutdown of the state. And that happened at like 3 o'clock in the afternoon, and it was a Friday. And I remember thinking, I was watching it on my little computer, and I thought, oh Lord, what's gonna happen now? And I know our seniors, so everything was shut down. I had about a half an hour to talk to staff before the end of the day, and we already started working then on a process of how we were going to reach out to the seniors. Everybody took their computers home with them. They started making lists of their clients to reach out to, because we do know our seniors, and our seniors were going to be scared, and they were going to wonder what was going on. They're used to coming in and trusting us. And Courtney from Aarp talked about trust, and local services are who they trust. That's who they know. And while I'm the care coordination unit for the 3 counties we're in, there's also a care coordination unit in DuPage County, and they know their seniors as well. So I know that even though I'm talking about how we did it, I'm sure they did it many things the same way. We knew that those seniors would feel isolated right away, not being able to come into their senior centers. So those telephone reassurance calls those first couple weeks were so important. I didn't know whether we would ever have to report on that to our funders. So I just asked staff, keep track of how many phone calls you make, who you're making them to, what the responses are, and what the questions are. And sure enough, you know, we did turn all that stuff in later, but at the time, that wasn't the important thing. The important thing was to reach out to those seniors and give them some reassurance and not let them feel isolated. So in those first couple of weeks, we were making thousands of phone calls, and I'm not kidding when I say thousands. So how did it impact them? They didn't get to see their families. They didn't get to see their friends. They got scared right away. We started talking about how we could purchase tablets. We purchased, as an agency, 400 tablets. We worked a deal out. And I don't know how many of you know, but it's not easy to teach seniors how to use those tablets. But we got it up and we got it going. And when we started scheduling classes, exercise classes, bingo, you know, their favorite is bingo. So we wanted to make sure that bingo was one of the first things that we got them comfortable doing via Zoom. We always scheduled 20 minutes ahead of time so that we could reinforce how to use those Zooms, because they would forget between the days on how to log in. So we always built 20 minutes of refresher class in at the beginning before the actual event was supposed to take place. We also started to do something called activity bags, or as some of our offices call them, festivity bags, where we started to gather together puzzles, word searches, rolls of toilet paper that we put in these bags, masks, and we started delivering these to their front porches once a month. And we relied on community partners to work with us on this, such as the sheriff's departments, the police departments. They are used to seeing seniors at our senior centers, and they're comfortable with them. And so township people got involved, and other providers in the community helped fill these bags up and delivered them to their front porches to give them something to keep them engaged, to know that they were being remembered. We worked with our own children and grandchildren to make cards to put in these bags that they colored and said, "We're thinking about you." As that evolved, we also got the high school kids involved, and we started pen pal programs where they were writing letters to the seniors saying, "We haven't forgotten about you. This is what's going on in my life." Great intergenerational things. And then also with the Zoom classes, it wasn't just exercise and bingo, but music. Anything that we could find that had to do with music. We made a relationship with the Elgin Youth Symphony so that several of their students could do Zoom classes and show, do performances. And so our seniors took their tablets, watched the young people perform, and they would even put their brothers and sisters who are in long-term care facilities, they would hook up their phones so that they could listen to the music on the Zoom that they were listening to. So the 400 tablets reached our seniors, but it also reached their family members so that they could be involved as well. We, of course, did the parking lot bingo when the weather was good. I have to tell you, parking lot bingo, if you haven't been a part of it, is so fun. When they win, they flash their lights, they toot their horns, and they wave flags out the window so that they can get their prizes. And you have to be creative on keeping your people connected to each other. They would park every other parking space so that there was the social distance. And we had prizes for them. And it was interesting because a lot of the seniors, as part of their craft projects in their festivity bags, would make the craft project, and they would want that to be given as a prize for bingo. So we shared that with each other. And then our staff learned how to do the evidence-based exercise classes via Zoom, because you can't serve as many because you're not seeing them face to face. So if there's any falls or anything like that, you have to have a smaller, limited group. We also did outdoor exercise classes out in the parks where they could stand socially distant. Now, you can't do that right now because of the winter, but our seniors are chomping at the bit to get back. So engagement comes in many ways. We did drive-through meals. Brown's Chicken offered to do little food boxes for us, and we bought those, and then the seniors would drive through, wave to everybody, and we'd give them their lunchbox. And we were lucky enough to have sheriff's departments and police departments involved in that, advisory council members from other provider organizations. So it really was a wonderful community event. And the beauty of this program was that so many volunteers stepped forward from the community. They were like, what do your seniors need? What can I do? We worked with our nutrition providers to do a once a week pickup of 5 frozen meals at our offices. And lots of volunteers came forward and said, we'll deliver those for you. So those who couldn't get out were able to have it delivered to them. So engagement came in many, many directions. And we are so grateful to the community partners. And then, of course, the tablets also were used with our ombudsman programs because they couldn't go visit into the long-term care facilities and advocate for the seniors like they usually do. So we earmarked some of the pads, the tablets, to go to the long-term care facilities so our ombudsman could communicate with the residents. Let's see what else. We did Facebook Live events where we videotaped things and they were able to jump right on that. We had up in Elgin a Copsicle cart where ice cream was provided out of this cart, and the seniors drove past and got an ice cream cone from the police department. What great events to build that camaraderie with law enforcement, that you want to learn to trust law enforcement. So that whole local piece. And then I just want to talk about the vaccinations a little bit. Michael and I have known each other in other roles for years. And I knew when this started that our seniors were going to need these vaccines. So I did reach out to Michael early, way before Christmas, I think, and said, how can senior services help with this? Because our seniors need this vaccine. So I want to get this up and rolling. And my biggest concern has been the people who don't have the electronics. You know, I know that all the millennials who do things, everything is electronic. I mean, it's not even a question. But I can tell you from having set up seniors with pads and tablets that I would say only about a third of our seniors either have them or know how to use them. And a lot of our senior centers are located in low income areas, and that's a cost to them. They can't afford that. So I knew that signing up for registrations only online was going to be very difficult. We have the hard to reach populations and the highest at risk populations with the Latinx, the Black community. And then in Elgin, we also serve a large Laotian population. So it was really important to me that we have alternatives for them to reach out. And I asked Michael if we could get in touch with Leslie and Marla from Age Guide and get this going from that level. And I think he was a little surprised when I said, there are other providers in the community who serve seniors who are going to want to help. So we opened it up and had meetings with the other senior providers, and we have 17 organizations that are willing to register seniors in the communities who for seniors who don't have electronics. So that's a huge collaborative out there that would have been untapped, but we know each other and we know we'll work together for the good of our seniors. It's not a competitive industry for us. It's about serving our seniors. And so he was shocked when so many people showed up for that Zoom class and agreed to sign people up. I just don't think he was prepared to see how outgoing our providers are for our seniors. So I'm grateful that our communities have this. And I know that there are large companies out there that are doing things as well. But I want to stress to the legislators that your local service providers are where things get accomplished. Give it to the busy people. You know, it used to be Girl Scouts and things like that. You'd always say, the one who's busiest, they're the one who's going to get it done. But your local service providers who serve your seniors are the ones who get it done because they know their seniors, they know what they want, and they're trusted by their seniors. And I just want to also thank Aarp, because they always do the volunteer taxes for us. And, you know, every single thing we do has had to be done different this year. I mean, we're doing drive-through tax drop-offs and pickups in our offices, but we appreciate that partnership because it's crucial for our seniors. So that's my big thing, is the advocacy for the seniors. We do what it takes, and we are grateful to have Age Guide working right alongside of us. And those first couple weeks, I can tell you that the Department on Aging, they were working from home too, but they were working shoulder to shoulder with us on figuring out new ways to provide services for our seniors. And the emergency senior services funds that were allocated and the CARES Act dollars that came out, they were crucial. So I just want to thank the legislators for that, and just let you know we're all out here, boots on the ground, trying to make things happen. So thank you.
Thank you very much, Mickey. I would really like to have the Copsicle come visit my office sometime. That's awesome. Now we're going to hear from some of our state and federal legislators and their representatives. Before we do that, I just want to reiterate Age Guide's policy priorities, which Marla shared at the beginning. We're focusing on caregivers, on COVID vaccine access, as all of the speakers have been talking about, long-term care support, and funding for Older Americans Act services in any COVID relief bill. Just wanted to reiterate those. And now remember, if you have questions for the legislators or staff, please put them in the chat and we'll read them off as time allows. I know that we have State Senator Tom Fullerton from District 23 here, and I'm going to let him speak. Also, I believe we have Leslie Reese from Congressman Krishnamurthy's office. Is there anyone else who's here who was planning to speak from a legislator's office that I missed somehow? I don't want to miss anybody. Put your name in the chat and we'll be sure to get you if you're here, and I apologize for any oversights. Senator Fullerton, thank you so much for joining us today. It is an honor to have you here with us. I know your district covers DuPage County, so without further ado, I'll turn it over to you.
First, thank you very much for the invitation and the opportunity to be here with you all today. I actually have an 11 o'clock caucus meeting, so I'm a bit late to that, but I just texted and let them know that I'll be there after once I jump off. First off, it's actually really good to see so many of you. Marilyn Shree, some of you I haven't seen in over a year, and it is heartbreaking to not see families and but mostly to not see friends, and to go through all of this together by only being able to do it via computer screen, pardon my French, sucks. And, I miss going to Glendale Heights every other month and calling bingo. I mean, I miss the interaction and the opportunity, and I have to compliment DuPage, Kane Senior Services for their incredible work with the Meals on Wheels program that's going on right now. And then I wanted to talk real quick about, obviously, legislative-wise, AARP can probably testify that I have been one of the people who have consistently pushed for funding and for making sure that the senior programs are not cut at any time during my entire legislative career. What I wanted to say about the vaccinations, first, we're rolling out, I think there's going to be a really big partnership that we just announced with the governor's office of extra vaccinations that'll be going out of Glen Oaks Hospital in Glendale Heights. So please feel free to look for those slots opening up. Also, last Friday and this coming Monday, 2 of my park districts have done massive vaccination sites. The Lombard Park District just did 500 when they partnered with Jewel, because obviously the OSCO locations, they can only do one person every half hour, where a park district has enough room, they could bring people in and they could do 500. Lombard said they could probably get 1,000 people in a day next time, and the OSCO is going to work with them on another vaccination site. So I know we always have challenges with seniors being sort of on computers and their ability. I saw it this morning on the news about some seniors not being able to get on the United Center list, and truthfully, the United Center list, when it first opened up, I think had some computer glitches, so that made it even worse. But obviously, friends and family are a big thing. And I would say to some of our providers out here, if you could recommend to your seniors to sort of go on local community websites as well, as they're trying to push out vaccines and they're getting partnerships with local pharmacies and with other providers. The city of Addison had a vaccination event. Glendale Heights has had a vaccination event. So within my community, we do have people who are trying to get it out. Now, sometimes the seniors find out about it, sometimes they don't. It ends up being, they just did another big one through District 88 that partnered with Elmhurst Hospital that I believe we pushed 4,900 people through over a 3-day period to do, and it was teachers, it was seniors, it was a lot of different people. I think that's going to be the biggest challenge is finding, and I know your agencies are incredibly burdened with the amount of work you have to do, but if you could help facilitate through local partners that may be having vaccination, I'm not even sure how you would call it, vaccination sites, vaccination parties. I think that would be a terrible word to probably say for it. But those are going on within local communities. So any partnerships you can get with them or pay attention for them and get the word out to your seniors. I know both park districts, Itasca and Lombard, have through their own programs, seniors that they know don't have computer access. So they actually do phone trees to try to make sure that they're getting people who are already initiated and within their park district to help them get vaccinated as well. I would say I'm watching the stimulus package incredibly closely. I'll let obviously the congressional delegation speak to that, or their people speak to that more than I will. I would hope that what comes out of that wouldn't hamper local governments' ability to send money down to state agencies and send money down to local agencies as we try to increase our care for our seniors, not only just with the vaccination, but with everything that's been missed over the past year. And making sure that our Meals on Wheels program stays fully funded and can continue. This pandemic has obviously shown the stressors on most of these programs for seniors. And my recommendation also would be to push staff as much as we can in the long-term care facilities to be getting vaccinated as well. I'm sure everybody saw what happened at our veterans home in LaSalle. We had 36 veterans pass away. And still within our veterans home, I believe we're almost at 100% on all residents vaccinated, but we're really at under 50% with staff being vaccinated, even though staff has had full opportunities to get vaccinated. So I think also information to your staffs and to the caregivers that part of their responsibility as a caregiver to take care of these seniors is to get the vaccination as well. Because just having the seniors vaccinated, but the people who are taking care of them still are at risk and still are within the community could be a big problem for them in the future. So I'm hopeful that we can get you all to do that. And, if you have any quick questions, please let me know.
Thank you so much, Senator. It was a pleasure hearing from you. Are there any questions in the chat for the Senator?
There were some questions in there, but it didn't look like they were directed directly at Senator Fullerton. So.
Nobody cares about me. It's fine. No, I'm kidding. Well,
I was already thinking about your shot party because I keep thinking of the vaccine shots as like taking a shot. So we can roll a party with it here.
Hopefully nobody makes.
Maybe that will get more people to the table.
Hopefully nobody makes a song about it.
There will be.
I'm going to jump on my other call. Thank you so much. And again, I can't wait to see so many of you in person again and not do it this way. And just please keep up the great work that you're all doing and let our office know. We're right in Villa Park. We're right in DuPage. I've got the entire sort of northwest side of DuPage County. So we'd love to hear from you. And if you ever need anything, please let us know.
Thank you so much, Senator. I'm sure we'll be in touch. Thank you. It's a nice surprise to have him. Next, I would like to see, is Leslie Reese still on the call from Congressman Krishnamurthy's office?
Yes, I am.
Unmute yourself. Excellent. Thank you so much for joining us. I understand you have a few words to share with us.
Well, just a few. I know Courtney, as well as others, have talked a little bit about the American Rescue Plan. There are just a couple of provisions that are relevant I'd like to point out. I certainly don't want to take a whole lot of time. I know we've got a lot of other speakers here, and just as an aside, this has been an excellent meeting, and I can't thank you enough for including us and providing such wonderful information and wonderful support. I'm the Congressman's Deputy District Director. And for those of you who aren't familiar with the 8th Congressional District, we actually run from the east side to the east side of our district touches on O'Hare, and we run all the way to Elgin. So the district encompasses parts of Cook, DuPage, and Kane County. Obviously, we are juggling the slight differences between all of those counties as we try to serve our constituents, especially with vaccine rollout. And we've heard a lot about that and vaccine funding today. There are a couple, as I said, provisions of the House Rescue Plan that is currently pending in the Senate, fingers crossed, very tightly. But a couple of really relevant provisions I'd just like to point out. The bill as it stands, as passed by the House, includes $37 million for commodity supplemental food program. And that really helps fund packages, food packages for seniors. So that's one provision that I do want you to keep in mind that directly relates to your policy agenda. $1.4 billion for the Older Americans Act, and that includes programs for nutrition services, home and community-based services, vaccination outreach, and caregiver support. And this includes $145 million for the National Family Caregiver Support Program. Obviously, we are facing a very big dearth in funding for caregivers right now, and that's something that the Congressman is particularly interested in making sure that we have available funding and additional funding there. There is an increase in the federal medical assistance percentage, the FMAP, raising that to 7.35%. And in that, there is an increase for state funding for home and community-based services, as well as a number of other services, plus an additional 15% increase to SNAP that runs through the end of semester. So those are just several of the directly relevant provisions I just wanted to make sure that you were aware of. Obviously, Congressman Krishnamurthy is in full support of all of these, voted for the package as well. A couple of other items that he has been involved with. The Congressman co-sponsored the Access Act. It's a bill that was primarily sponsored by Representative Jan Schakowsky. It would provide funding to develop telehealth and virtual visit capacity for certain nursing facilities. And that's another piece of legislation that is moving through as we speak. I also wanted to thank everyone for the opportunity to remind everyone on this call and all of your constituents, clients, patients, that our office is always available to assist in any issue involving federal government agencies, but frankly, any government issue that any of your agencies, your clients, your people have. We are always available, even though we aren't necessarily in the office. We have a fabulous team of caseworkers and other staff that will go to the max to help people through whatever kinds of problems they're facing right now. Best way to reach us is via email. Let me give you our email address, and I'm sure we can distribute that as well. You can reach us through the Congressman's websites, social media, but we do have a specialized helpline, and that helpline is available at il08.helpline@mail.house.gov. And we would welcome any issues, any questions, anything that we can do to help. One of the Congressman's greatest priorities is constituent services. We have a lot of folks dedicated to that, And we don't really look at district borders particularly. Anyone who calls our office is going to get help. So please take advantage of us. We are here for you. And again, thank you so much for including us, and happy to answer any questions if I can. So thank you, Gretchen and all.
Thank you so much. Appreciate you sharing those helpful comments. And I put that helpline email in the chat if anyone didn't get to write that down quickly enough. That's really useful to have. Thank you for that. Are you seeing any questions in the chat, Leslie?
Yes, there is one in regard to telehealth. Will financial help be available to cover the cost of the infrastructure needed to access the internet will that be available?
My understanding is that is contemplated in the bill. At this point, we can't guarantee any of that will survive the Senate, but we are hopeful.
Thank you.
I think that one thing that when they're looking at infrastructure, it's not just roads, it's not just, it's really that internet infrastructure too. So the administration's focusing on that. Our hopes is that they're going to look at how we can build that out in our local communities as well.
I would bet that your office, Leslie, is getting a lot of calls about the vaccine, as are we. And I think it's a matter of helping people to navigate this right now. And then hopefully, like everybody's saying, we're going to have more availability coming up soon. But there are, there's a number of messages in the chat. People are just frustrated trying to track these vaccines down. And if there's anything at AgeGuide can help people get on registries. If you need help getting on the registry, you can give us a call. You can call Senior Service Associates. They can help you get on the registries. And then it's just a matter of waiting and being patient until either there's more supply or your name gets pulled. Just wanted to let people know that. I just want to check and see if we ended up having Maria Manzo on the call. I'm assuming she wasn't able to make it.
I'm here.
Oh, you are.
I am. Yes. Thank you, Gretchen.
Excellent. I'm so glad you're here. I'm sorry, I didn't see your name, so I was afraid that we had missed you somehow. But welcome.
Okay, I know. Thank you.
I know you're from Representative Bill Foster's office, and he's a great friend of AgeGuide's as well. So welcome. Thank you.
Thank you. Thank you, Gretchen. I know it can get kind of tough with all the screens and moving back and forth. And I know like on our laptop here from work doesn't have a camera, so I'm always on my phone and I always tend to miss things. So, but yes, thank you, Gretchen. And as Gretchen mentioned, my name is Maria Manzo. I am the Senior Outreach Coordinator for Congressman Bill Foster. Congressman Foster represents the 11th Congressional District in Illinois, and it includes parts or all of Aurora and Naperville, Oswego, Plainfield, Joliet, and all the little towns surrounding, many little towns surrounding it, I should say. And he does wish he could be here. Gretchen, as you mentioned, he's a friend of AgeGuide, AARP, and many of the senior services organizations here. But he senses his regrets that he's unable to attend today. But I'd like to begin by thanking Gretchen, you, AgeGuide, AARP, both of you are indispensable organizations which are committed to bettering the lives of older adults. And our office is in constant contact with you in communication as you work diligently to protect the dignity and livelihood of all seniors that you serve and all seniors in Illinois. So I'd also like to thank all the organizations, senior services groups that are on this call. You guys are an important part of providing the services that are crucial to our older adults in our communities, and we always enjoy hearing from you. And as we continue to battle this pandemic and see the progress that is being made, just know that Congressman Foster continues his commitment to doing everything that he can to ensure that the services and the resources that are most needed during this time are available and accessible to our seniors. He did vote to pass the latest relief package, which Leslie just mentioned some of the funding available in there, and it is expected to pass the Senate this weekend. So those programs that Leslie mentioned are funded in there, and he supports that. In this past year, we have met virtually with various groups in our districts that represent the interests of older adults. And we definitely understand and see the need to battle food insecurities, address prescription drug programs, and ensure that those programs that are needed the most are accessible and are funded. So he continues to work hard for that. And although 2020 restricted us from meeting together and getting into groups, and I know we collaborate a lot to go into those groups and talk with our seniors, Congressman Foster did partner up with AARP. So thank you, Courtney. I think I saw you in there. For a teletown hall, at that time they discussed the current CARES Act that had just been passed. So he's always trying to figure out, and our office are always trying to figure out how we can reach and provide that information to our seniors and in partnerships with you. So in this ever-changing economy, you know, we must continue to ensure that our seniors are properly cared for and able to support themselves. And Congressman Foster is, again, working hard to make sure that happens. And while he continues his work in Congress to protect the lives of our older community members, organizations like you, Age Guide, are essential, and we look forward to continuing these discussions here today. He will be with you next Friday to provide some more of those updates. And yeah, so I know he's looking forward to that. So thank you very much.
Excellent, and we look forward to seeing him at that. Thank you so much, Maria. We appreciate your comments and your support. I don't see any questions in the chat, and we're just about out of time. I'm so glad that we had so many of our representatives and staff here with us today. I wanted to remind everybody to stay in touch with Age Guide. We have lots of tools and resources to help you stay up with the latest on what we're doing and what's important to older adults and caregivers. We have a page specifically with resources for the vaccine. So I want to encourage you to engage with us on social media. As soon as we end the webinar, if you're not already, please follow Age Guide on Facebook and Twitter. And there you'll find that we post lots of useful articles, resources, notices about events and even vaccines, lots of useful information on our social media. And then there's our monthly newsletter called the Aging Report that's stuffed with information. You can sign up for that on our website. These things are a great way for all of us to collaborate and advocate together for older adults and to stay in touch. So this concludes our Advocacy Collaborative, and we hope that you found the information helpful. And we do have 2 more events coming up. There is another one on Monday at the same time and one next week, Friday, for the different counties that we serve. So if you're interested in jumping on one of those, go ahead and check out the registry on our webpage. Thank you so much for joining us today.
Thank you.